Okay, here we go. 2017 ICD-10. I teach out of this Carol Buck. Now, when you actually start working and stuff, you may have an expert edition or something. There are some publishers I don't care for. I think Carol Buck does a good job of the color coding. A lot of the publishers are going to that now. So, you know, it's easier to find a good edition. But this is what everyone should have, professional edition. I'm going to have to move sideways some here because in order to get close enough, the book's really big. So we're going to do a lot of moving side by side. So let's just start getting into it first. Does have a contents page here. Doesn't really help us with anything. We do have some instructional notes here. This will be good for you once we talk about them, and this will be a good refresher for you to kind of come back and see what the symbols, the notations mean, that kind of thing, the different letters that you would see, that kind of thing. These, just like in the CPT, on the bottom, on the bottom of every page has the conventions, symbols, all of that. It's on the bottom of every page. This is a good overview, kind of like what the HCPCS had, an overview of how to read things, what's indented, what with means, all of that kind of thing. For right now, probably a little bit overwhelming to try to take in. This is, this first part is where you'll want to come once we kind of get familiar. There's just a whole lot of parts to it. Whereas CPT had a whole bunch of different organs that we went through. This book, once you get the hang of it and you get how to read it and interpret it, then it's all the same. Yes, there's respiratory illnesses and there's cardiac illnesses and injuries and that kind of thing, but the conventions all stay the same. You know, they're applied the same way. If there's a code first, it's applied the same way regardless what your disease process is. If there's an includes or an excludes, those kinds of things, the rules all apply to every code in the book. So it's once we get an understanding, it's going to be easier than the CPT, in my opinion. I think it is. Okay, so we know that this information is here. Will be a good reference as you're going through the textbook. You can come and kind of see what their explanations are too. But still working through. There's some updates. If you didn't know the ICD-10 before, I wouldn't worry about the updates now. They'll just confuse you. So I would just skip over all that. I hardly ever look at that stuff anyway. I mean, when you're using it every day, and you know, there's stuff at the end of the year before the new one comes out or before October 1st that, you know, we're able to catch up without having to read all that stuff. Okay, so labeling. Not going to be as much labeling as in this book as there is with the CPT, or at least I don't think there will be. Some people label every body organ system in here too. It's up to you if you want to. It's all numerical, so it's alphabetical in the index and it's numerical in the tabular, so it's whatever's going to be easier for you. The first part that I would tab, and if your book is just like mine, then it's all these red pages here. These are the guidelines. You see I have my tab. It's just one of those kind of, not paper, it's like plastic tabs. And I put guidelines. We'll come back to the guidelines. They're imperative to know, but we're not going to start there by any means. Then you have these green pages. These green pages are your pictures. Great places to put notes, medical terminology stuff pertinent to whatever's on the page. Really good notes in here. If you're trying to figure out a part of the ear, then this will very much help you figure out whether it's the outer ear, inner ear, middle ear, whatever it is. Really good pics in here. Same thing in your hick pics, had good pictures. Okay, so now we kind of start talking about the rest of the book as a whole. The rest of the book is divided up into two parts. The first part, which actually is part 2, is the alphabet index. Now, you know I told you with CPT I wanted you to get familiar enough with the manual that you would not have to go to the index. This ICD-10, you must. All of us do. You have to go to the index, find your diagnosis code, and then you verify in the tabular. So I'm going to go to the tabular. Hold on. There's a lot of stuff in between. So we have our alphabetic index, and then we have our tabular, the tabular. So the index is all of these gray pages. That's the index. That's all of the disease processes just about known to man. I'm sure there's some variations, but pretty close. All alphabetized. There is an art to looking stuff up. We will work on that. There are action words that will help you get where you need to get for external cause codes and all of that kind of stuff. All of that will come right now. This is just the basics. Okay, so if you want, I don't tab it, but you might want to tab the index. This would be the second tab. The first tab was the guidelines. Now I would tab the index. So all of these gray pages are the index. Then we have, starting on page 467, kind of this pretty periwinkle blue. All of these blue pages here is called the Neoplasm Table. And if you, let me pull my book over just a little bit. I think that maybe will help us if I go that way. You guys probably have already figured that out, and I'm just late realizing it. All of your book is labeled. See how it has all the different labels? I only label the stuff that I know I'm gonna be having to get to or find maybe in a hurry, or, oh, I just need to go straight there. I don't want to search for it. So this is the Neoplasm Table, and here is where you find most of your cancers. There's a few that won't be in here, like your melanomas, your adenomas, any tumor that isn't a part of just 2 or 3 carcinomas. Most of the tumors are within neoplasm. I label this as Neo. You label it any way you want. Table of neoplasms if you want. We'll come back and talk about this. Right now we're just going to get through the book. Then we'll come back and talk about some stuff. The next section, it's your table of drugs and chemicals. But if you look, and it starts on page 495. If you look, these are poisonings. So in the HCPCS, we had our J codes that were the drugs that are administered to people. Here is a table of drugs, very, very different. This is for your accidental overdoses, for your suicide attempts, for your underdosing of medication, for your adverse, your allergic reactions to medicines. This is your alcohol poisoning, your heroin poisoning, that kind of stuff. So it's a little bit different. Now remember, this book, we've done CPT, which is action. That's the procedure. That's the actual action that the physician performs for a patient or on a patient. This book, the ICD-10, is the diagnosis that will establish the medical necessity. And what I mean by that is, let's say a patient has a fracture of his left arm. We get the action out of CPT and we find our fracture code, and then we find a fracture diagnosis. which establishes the need for the procedure to fix the fracture. So that may be elementary for me to be telling you, but I don't know. It always helps me for someone to connect the dots for me. So if they're already connected for you, then ignore me. Okay, so this is your poisonings. I label it as just poisonings. We'll come back to that. Then we have an orange section here. Orange section, this is our external cause of injuries index. Used to be in ICD-9 world, these were E codes. I still sometimes call them E codes. I'm trying to train myself to call them external cause because they're not E codes, because they don't start with E's anymore. But they're the same kind of thing as the old-timey E codes, injury codes. These are external cause codes. So this would be the car accident. Okay, you have whiplash. You go to the emergency room. You got whiplash because you were rear-ended in the car. So here is where we would find that rear-ending in a motor vehicle as a driver or passenger. I label this as external cause. Okie dokie. Now that's all the tabs that I have. As we go through the different chapters, they call them chapters in here. As we go through them, you may want to label whatever particular maybe disease process or whatever. Starting on page 636, up at the top it says chapter 1. And if you see, all of these codes start with an A. And for chapter 1, these are your infectious and parasitic diseases. And then it tells you from A00 to B99 are all of my infectious disease with my parasitic disease. So this is going to be AIDS. This is going to be every kind of infectious, funky stuff, your streptococcus and your staphylococcus aureus. All of that's in here in the A's. MRSA is in the B's, your MRSA. So that's what's in this section. We're not getting into how to read this yet. We're just still kind of walking through the book to see what's even a part of the book. The next chapter, and it's easier for me just to go to colors, the next chapter, and you can see they have printed the guidelines section that I told you in the front of the book that we would come back to. They have printed it in front of each of these chapters. So it's kind of a quick reference, so you don't have to go all the way to the front of the book. This is a nice addition. Okay, the second chapter starts with our green guidelines, which we're not worrying about right now. We're not worrying about how to read the book either. We're just kind of walking through the book first. Chapter 2 is your neoplasms. And you can see here, chapter 2, neoplasms. They go from C00 to D49. Okay? Like I said, if you want to label this stuff, you can. If you don't, that's fine too. I just don't label it because it's alphabetized, so you can, it's easy to get to. Chapter 3 is your disease of blood and immune. That's these green pages. The blue pages, chapter 4, goes into the endocrine and metabolic. This is where you're going to find a lot of your thyroid stuff, parathyroid, anything endocrine is going to be in here. And remember, we're thinking diseases now. The cause of what's wrong with someone that makes the doctor have to have an action, which is our CPT. Chapter 5, this is our mental behavior, mental health stuff in here. All of these, St. Charles Place, if you play Monopoly, that's the color, in my opinion. Chapter 6 is the nervous system. This is the orange. Starts with our green guidelines. And then all kinds of nervous system kind of stuff. So nervous system would be brain and spinal cord, meninges, nerves all over the body, all kinds of stuff in there. Chapter 7 is the eyeball and the adnexa. And then there's a lot with the eyeball. This is where your cataracts, anything with the eyeballs in there. Chapter 8 is the ear, anything with the ear. We're still just kind of walking through just to get familiar with what the book even has in it. Chapter 9, with your guidelines here, is the circulatory system. All of these start with eyes. I code a lot out of the eyes because we've got a lot of cardiovascular stuff for everybody. Chapter 10 on page 899. This is the respiratory system. So this is where you can find pneumonia, you can find upper respiratory infection, you can find asthma, you can find COPD. That's all the stuff in here, plus a heck of a lot more. I'm just dangling out a little trailer of sampler. I'm like the Beauty and the Beast trailer, sing along. You can sing along to the ICD-10. Okay, sorry. Chapter 11. Diseases of the digestive system. These are all K's, so this is where GERD is and bowel obstructions. Anything that has, think about all the body parts that are in the CPT, those are the diagnoses for there. Within the CPT digestive, I mean. Okay, chapter 12 is the orange. This is skin and subcutaneous. Oh, I love pictures like that. Oh. So all kinds of boils and abscesses. There's good stuff in the skin. Chapter 13, chapter 13 is the musculoskeletal. And I'm just kind of getting through my purple pages here. They vary in color. Lots and lots in chapter 13 because this was the section that was the most enlarged or the most added, codes added to the most is the orthopedics, your fractures and your subluxations and your dislocations and everything in between. So these are your M codes. This is also where you would find like rheumatoid arthritis is in here. Anything dealing with the bones or connective tissue. Really big section. Okay, chapter 14. Chapter 14 is your genitourinary. Not very big section because there just aren't that many organs. A lot's packed in there, but it's not too bad. Then chapter 15 is the green, and it's your pregnancy, childbirth, and postpartum or puerperium, however you want to say it. My least favorite of the book, if anybody knows me, they know I don't. I love babies, and I love pregnant women. I just don't like it when they give birth. That's not fun nursing to me. I'll take a heart attack any day. But I'll love on those little babies. Okay, so that's what this section is. Chapter 16, this is issues originating in the perinatal. So these are congenital things, stuff wrong with the baby, newborn issues. That's what this section is, falls right after the pregnancy section. Then we have Q, which is the congenital malformations, deformations. I was afraid I was going to say that wrong. And chromosomal issues. Your Down syndrome would be a Q. So that P is more geared just toward the newborn or the neonatal. This is geared more toward your congenital that's going to have ongoing, perhaps even lifelong issues. Okay, chapter 18, signs and symptoms. This is where your abnormal labs would be, your kind of catch-all. We're not crazy about this section. Insurance companies aren't crazy about it. They don't like you just giving fever, which is an R50.9. They don't like that because they would rather know the actual diagnosis that's causing the fever. Now, sometimes you don't know that. So that's why you have a signs and symptoms section, and we'll go over how and when you use them because there are specific guidelines that tell us when and where we can use them. Chapter 19, this is kind of a big chapter. These are S&T codes. It may actually be bigger than the, it probably is bigger than the musculoskeletal. I'm trying to get down to the bottom of the purple, but we're still going. Okay, so it goes all the way to 1426. So it's, I don't know, 3/8 of an inch thick. This is your injury, your poisonings, and then it says consequence of external causes. So if you had that car wreck, this is probably where you're going to find whiplash. If you fell off a building, this is where you're going to find injury to your back, you know, whatever it is, if it's not a fracture or something. Well, yeah. Okay. But all your poisonings and stuff are those T codes there and there. Okay, so chapter 20 is external causes. There's all kinds of stuff in here. It's fun to read through it. This probably in the long run is going to be the hardest codes to come up with because they're just so subjective and a little bit more difficult to find. And then the last chapter is chapter 21, factors influencing health status. And if anybody knew ICD-9, these are a lot of the V codes that we had. We don't have them anymore. Okay, now a couple of other things. Oh no, we've labeled everything. Okay, so now I want to, what do I want to do? I want to look at a code. Let's just open the book. I opened up to page 963. It's codes L98. So I'm going to give you a minute to find that. L98. And I just randomly opened to a page because it wouldn't matter. So, okay, so we're on this page, 962, 963. First thing I want to talk about are all of the symbols across the bottom, okay? Because that kind of helps us learn how to read the codes. Because when we go and we start reading all these big words and we see red stop signs and excludes and includes and arrows and code first, I mean, we have no idea what to do with it, which is okay. We're going to learn. Okay, so when you see, I'm going to start way over here in the left. When you see a green sideways arrow, like what we have right here, it's just telling you that's a brand new code. It doesn't really matter to anyone who doesn't know the previous codes, so it isn't necessarily that pertinent to us. The blue arrow that kind of looks like it's phased in, that is a revised code. There again, if you didn't know the old code, you won't necessarily care about the new code. So those don't really matter too much to us. There are some deleted codes in here. Again, that's for the people who knew the previous versions of the ICD-10 or ICD-9, and they're just alerting us that stuff has changed or that code isn't available anymore or maybe has changed to something else. When you have your excludes, let's see, look at code L98.5. L98.5. We're not getting into how many numbers and letters we have yet. We're not doing that yet. We're still just going through the conventions. L98.5. It's on page 963, second column, third code down. Underneath it, it has an excludes too. L98.5 is mucinosis of the skin. The words right under it that are not bold give you just a sample of what you might be seeing in the medical record, not an exhaustive list, just a sample. Like maybe your chart says focal mucinosis. Maybe that's what your chart says. The index told you to come here, you're verifying your code, and sure enough, there's the words, you've matched them up so you can use that code. The excludes means perhaps your focal mucinosis was actually focal oral mucinosis. So the excludes one tells you if you're looking for this oral code, you need to go to this K13.79, and you can't code these two together. They exclude each other. You are not allowed to code them together. So the excludes for me is really a good way for me to make sure I'm in the right spot, and maybe I'm not looking for a little bit of a tweak to my code. So if we're looking for only focal mucinosis, then we would do L98.5. If we're looking for focal oral mucinosis, then we would go to K13.79, and then we would go there now, verify it, and then that's the code we would use. So that's how the excludes one works. Back down here, excludes two. Are there any on the page? Yes. Okay, so let's go into the first column here under L98. We indent down to L98.0, pyogenic granuloma. And excludes two means if you're trying to code what is above the excludes two, you may also need to pick up one of these. So when excludes two means you may need to code me two. Okay? Excludes one, you cannot code together anytime, never. And excludes two, you can code them together if they're pertinent to your scenario. Okay, back down here, includes. Do we have an includes? I'm going to turn the page once. Yes, we do. Turn the page just one time to 964. So we're on page 964 now. There is an includes. So what this includes means, and it doesn't matter where it is, what it's telling you is that this arthropathies, the M00 to M25, are all going to include disorders affecting predominantly peripheral joints, limb joints. So the includes means this is included in what you're looking at. Let me see if I can find a different includes. Okay, go to page 989. 989. This includes, I'm under code M15, polyosteoarthritis, osteoarthritis. This includes any of these polyosteoarthritis, so anything that's an M15 is going to include arthritis of multiple sites. Now that makes sense to us because poly means multiple. So they're just helping to clarify. Okay, we'll just stay here. Let's go, I'm back down here. Use additional. Do we have a use additional on this page? No. Let me get to another. Okay, so I'm on page 815 now. Isn't this fun? I actually love doing this. It makes me a nerd. Okay, page 815. Up at the top of the first column, code H26.3. H26.3. It's a drug-induced cataract. And then the little clarifying or giving you example, the non-bolded says toxic cataract. So if you're looking for a drug-induced cataract and your notes actually say toxic cataract, you're absolutely in the right place. I love everything always written. I love that because it really helps me know I'm in the right spot when I'm verifying. So the use additional here means, says use additional code for adverse effect if applicable, only if it applies to your scenario, to identify the drug. So if your cataract, drug induced, if you have cataracts because of a drug, then it's telling you you've also got to pick up one of these T codes. So use additional gives you a sequencing. When anything says use additional, it comes after this code. So you would code your H26 whatever, and then go find your T code and then code it. Because sequencing will matter in ICD-10 in your diagnosis codes. And we will talk about that. But that's how you use your use additional. Okay, let's go back down here. I'm on my blue code first. And right above here, I'm on page 814, code H26.23, glaucomatous flex, and I may not have said that right because I'm not major into eyes. Glaucomatous, I think that's right. So the green code first means you have to code if there's an underlying glaucoma. You have to go code that glaucoma first and then come back here and pick up your code. So code first means go someplace else, get that code, and then come back here. Your use additional means code here first and then go find your extra code. So that's the difference between them. They are telling you the order that you put your diagnosis codes in. Code also is much like use additional. It's very, very close. Here's the code also on the same page under H26.22. If you have a cataract secondary to ocular disorders, code also what that associated disorder is. So that's again telling you the sequence. You would code here first and then code also that ocular disorder, the associated disorder. Then we have our purple unspecified. ICD-10 was supposed to take care of all of our unspecified codes, but lo and behold, half the book is unspecified codes. I find it interesting. Insurances do not like unspecified codes. If you can possibly not use one, that's what they would prefer. But you know, it happens. Sometimes we have to. So unspecified is exactly that. Previously, ICD-10, we did not ever have a code that gave us a left or a right or a bilateral. Now with ICD-10, they call that laterality. We do have laterality. So that's one of the reasons why the insurance companies don't like unspecifieds, especially if there's a left eye, a right eye, and both eyes. There are actually codes to account for all of that. So let's stay right here under H26.22 and let's look. H26.221 is for the right eye. H26222 is for the left eye. H6223 is bilateral. So there really technically is not an excuse in this scenario to ever use unspecified. The docs really, in my opinion, do a very good job of telling you it was the left arm, the left toe, the right eye, whatever it is. It's in the documentation somewhere. So they've just, now ICD-10's just kind of made us as coders and made the docs make sure that that right and left, that laterality is in there. So you would obviously plug in a right eye, a left eye, or both eyes long before you would use that unspecified. Okay, so the little writing up underneath here, OGCR, those are official guidelines. Anytime you see the OGCR or down here you see the coding clinic, and I'm trying to see if there's any on this page, and there are not. Those are just telling you that the guideline for how to use that code, and I'm trying to find one real fast. The guideline for how to use that code is either published as an official guideline, which is in this book or online, or it's published within the coding clinic. which is kind of the guru decision maker for all the guidelines and how we use codes, at least ICD-10 codes or diagnosis codes. For us, everyday coding, I ignore them. I don't pay any attention to it at all. Most of us don't have. I do have access to the coding clinic. It's a very expensive platform to get information from, and some employers, especially your hospitals, facilities, provide it for the coders. Some companies don't. Most companies don't. It's really expensive. So it's, me personally, it's for you guys to learn how to use this book and to pass your boards and to work in everyday coding. It makes no difference, but that's what it means. So when we run across one, I'll let you know. I'm not going to sit here and spend a lot of time trying to find one. I do need to go to some specific codes right now so that I can show you these next conventions. Maybe. I thought they would be in here. Oh, look on page 728. Page 728. I'm in the E codes. I'm in the diabetes codes. Sadly, near and dear to my heart. You will, there's some coding clinic I was just going to show you. So on page 728, middle of the second column, underneath code E11.36, this is telling you that the coding clinic, the year 2016, quarter 2, page 36, tells you how to use that code if you need any clarification. That's what it's telling you. But there again, if you do not have access to the coding clinic, you're just out of luck. And most of us don't have. I mean, generally we don't have access to it. Okay, now before wait, I'm skipping the X and I'm skipping the red stop sign. So the last one I'm going to go over, well, no, and then I'll talk about these, is the little half moon or the half circle yellow, and it says manifestation code. It's hard to find these. When you come across a manifestation code, what that's telling you is the code that you're looking at, the code that is the manifestation, you're going to need another code with it, because this code is because of something else. It's a manifestation from another disease process. So we'll just have to come across one of those. Maybe on one of our calls we'll come across one. Okay, now across the other side, these are super easy. They're just single letters. If you see a pink N, it's newborn. That would be neonate, 28 days and under. Pediatric, 0 to 17. That would be 29 days to 17. Maternity, that would be any maternity diagnoses are only applicable to females from 12 to 55. The 12 scares me, but I guess that's the world we live in. A is an adult, 15 to 124. I didn't know we lived that long, but we can all hope. Then you have your gender sign for female and your gender sign for male. Now, why are these things pertinent? If the code you're looking at is a code for newborn, but your patient is 50 years old, you can't use that code for that 50-year-old. You're going to have to go find the adult code. Conversely, if you're looking at an adult, one that's a code that's only for adults, and you're trying to put it on a baby, it's not going to work either. Insurance will deny it. There's not a lot of these in here, but that's what that means. You can't give a male a pregnancy code because they can't have babies. So they mutually exclude each other. So that's just kind of a guide to let you know how to not get denied or not to use certain codes for certain things. Okay, so now let's talk about actual code structure in the book. Aren't you excited that I finally have gotten to that? Your code, all the codes in this book start with one letter, A through Z, one letter. Then there's numbers. You will have a letter and two numbers, and then the decimal, and then you can have up to 4 characters after the decimal. So you can have a total of 7 characters. Some codes do not have to have that. Some codes do. When you look, I'm still on page 728. So when we look at code E11.36, E11.36, this has no symbols by it. There's nothing that we have to come down here and look at convention-wise. So that code is good to go. And it's 1, 2, 3, it's 5 characters long. Letter, 2 numbers, decimal, and then 2 more numbers. 5 characters. Now let's look at the one right underneath it. No, let's look at the one above it. Let's look at E11.35. E11.35. This has a red stop sign. For you older folks like me, it looks like a red dot, but it really is a stop sign. In different versions, it may be a stop sign. I mean, it may be a dot. I had to look again to make sure mine's a stop sign. Anyway, regardless, down here it tells you have to use an extra character. So anytime you see a code with the red stop sign or red dot beside it, you cannot use that code as it is. It's not a whole code. That stop sign or that red dot is telling you you have to add something to it in order for it to be a valid code. So let's look here. Type 2 diabetes with proliferative diabetic retinopathy. And it's telling you one of the following 7 characters is to be assigned to subcategories E1135 to designate laterality of the disease. So you have to add a 7th character, and I'll tell you how to take care of your 6th in a minute, but you have to add in the blue box underneath. You would have to pick whether it's a right eye, left eye, bilateral, or unspecified. Thank goodness we've already gone over those, so they're a little familiar. When you have a red stop sign and an X, then the X tells you down here that you have to use a placeholder. So that means if, let's say, E11.37, type 2 diabetes with diabetic macular edema resolved following treatment. Let's say that was of the right eye. The full code would be E11.37X for a placeholder, 1 for the right eye. The placeholders always go in the 6th position. So right now we have 1, 2, 3, 4, 5 characters, the X for the 6th, and then the 1 for the right eye. So that's how we do the place. You can do it one of 2 ways, get you to the 7th character. You either have the codes that have the X beside them and you have to manually put the X in as a 6th placeholder, or you have the codes like up here. They're indented. So these codes here have already gotten a 6th place to them. All you have to do is add the 7th. So there's 2 ways to get to the 7th character. Both of these directions here are telling you that the numbers in the blue box have to be the 7th character. You can either do it by way of indented and then add your 7th, or you add an X in your 6th place and then add your 7th. Kind of confusing, but we'll practice this. And the book has good examples. Let's do another one. Let's do another one. I'm on page 826. 826. Code H44.2. H44.2 has a red stop sign. That tells me that H44.2 is not a complete code. It's not a valid code. So since there's no red X here, I have to look up underneath. And so anything that's up underneath is a complete code now. So H44.20, H44.21, H44.22, and H44.23. Now, something that will it's a shortcut or something that's kind of makes it a little easier for me, organization in my brain. Anything that is right, whether it's a right finger, a right eye, a right leg, if right is in the scenario or in the diagnosis, then your code's going to end in 1. Whatever your code is, it's going to be a 1. If it's a left, it's going to end in 2. And if it's a bilateral, it's going to end in 3. And that isn't just for eyes, that isn't just for ears, that's for legs, that's for anything right, left, and bilateral is 1, 2, 3. So that may or may not help you. Okay. Let's go to the index now. Now we kind of know, we've gone over all the conventions. We don't know them by heart, but we kind of know them. Let's go to the index. Now we're going to actually try to find a code. I hope you can see that. Okay. So let's see. Let's find anemia, plain anemia. So I'm just going to open up, go to my anemia. This is a new book. I don't use this book. This is another one. And this is where, just like you forgot your numbers in CPT, this is you forget your alphabet. So on the bottom of page 101 is your anemia. When the word starts or when the diagnosis starts, it's in red. Everything underneath it is indented and pertains to anemia or to androblastoma or to amputation or, you know, whatever it is. So if we look at anemia, we see several words in parentheses: essential, general, hemoglobin deficiency, infantile, primary, and profound. All of those are in parentheses. These are what's called a non-essential modifier. They are just helping to clarify for you some kind of words or documentation that you may find within however the doctor is documenting that might, like if he says patient has essential anemia. Well, anemia is your big dog problem. Essential is just describing what kind. Essential is in the parentheses, so you know that any of these parentheses still go with the code D64.9. Doctor says patient has primary anemia. Still, that is an essential modifier. It's in parentheses. You're still going just for D64.9. Now, let's say doctor says patient has amino acid deficiency anemia. Now, that's not a part of the parentheses. So we have to go under anemia and find it. It's the very last one. It is D53.0. So that's how you use this. So let's verify. Let's say the doctor said patient has primary anemia. We come to anemia. Primary, yep, it's right there. It's got to be D64. So this is where you verify. You never ever in this lifetime code from the index. I promise you, you'll get a few right and then you'll get a whole lot of them wrong. Do not ever. The process for ICD-10, everyone, every coder out there does it this way. You find your code and then you verify in the tabular. So I'm going to go verify D64.9 is in fact primary anemia. So I'm going to go to my D. D64.9, it's on page 712, and it just says anemia unspecified. So I know that my doctor told me primary anemia. I know that the index said primary anemia, and I come here and I verify it is in fact anemia. The index said primary is included in this. It's a non-essential modifier. So D64.9 would be the accurate code. I don't have any stop signs. I don't have any conventions. This code's good to go and I can code it. Okay, let's do another one. Let's do isn't that terrible? I can't even think of anything. Let's do bronchitis. Bronchitis. Plain old bronchitis. I didn't say acute. I didn't say chronic. I said bronchitis. It's on page 129 at the bottom of the first column, bronchitis. And our non-essential for bronchitis here is diffuse, fibrinous, hypostatic, infective, and membranous. And it's J40. So if we had bronchitis with the flu, so bronchitis with flu, then it tells us where to go. It says, well, you need to go over to influenza with respiratory manifestations. The NEC that you see right there, that is not elsewhere classified. Not elsewhere classified. That just means there's no other way to classify it. That's just all you get. Let's say that it's bronchitis. Let's say it's acute bronchitis. So we're here at bronchitis. So now let's go down to acute. So acute or subacute bronchitis with bronchospasm or obstruction, wouldn't matter, is J20.9. Let's say that it's chronic bronchitis. Here we're at bronchitis. We go down to chronic, J42. And then if it's chronic bronchitis with asthma, then we would go to bronchitis, chronic, asthma, it's J44.9. I saw something just a second ago. And NEC, it was on this page. I swear it was. I saw it. Okay. Look on the third column, still under bronchitis. There's another spirochetal bronchitis, not elsewhere classified. And then I thought I saw an NOS. NOS, anytime you see that, is a not otherwise specified. Kind of the same as NEC. Well, we'll run across one. Okay, so let's verify the very first one. We kind of played around with how to work the index once we get here. But we had originally gone to bronchitis, which is J40. So let's go verify. I'm going to my J's. That's my respiratory section. IJC. I'm telling you, you lose the alphabet, you lose your numbers, you're just sunk. J40. It's on page 906. Bronchitis, not specified as acute or chronic. This is just, all they told you was plain old bronchitis. Now, up underneath here are those terms that could be in your documentation. So we have bronchitis and NOS not otherwise specified, but maybe the doctor diagnosed tracheobronchitis. Well, that would still be the same code. Or bronchitis with tracheitis, still the same code. Then we have our use additional. So use additional, that's telling us code here first, and then use an additional code if any of these apply. Have they been exposed to tobacco smoke? Tobacco smoke during perinatal, history of tobacco dependence. So they're trying to get you to track the smokers, which I kind of think is not fair, but I guess it is. I mean, I'm not a smoker, but whatever you want to do, I don't care. But that's kind of where they're going with this. So if your patient has bronchitis and happens to be a current smoker, maybe, on the chart you see that they are currently using tobacco, then you would, depending on how it's written, has the doctor said they're dependent on it, or did they just say they use tobacco? Depending on how usually the tobacco use is a history, and the current use is the F17, generally is how that's used. Then we have excludes one notes. Remember, exclude says you cannot use this code with any of these codes. So they're telling you if you're here at bronchitis and you're actually looking at acute bronchitis, you better go here instead and forget about this code. Or are you looking for asthmatic bronchitis? That's J45.9, whatever. You leave this code alone and go someplace else. That's what your excludes one means. Okay, let's do one more. There's still quite a bit of tweaking to all of this. This is just the basics. There's a whole lot of pregnancy stuff and just crazy stuff. Okay, let's look up headache. Go to headache. In the index, remember we always go to the index first. Okay, headache is on page 266, third column, up at the top. Headache says R51. Now, let's say you knew that it was a cluster headache. So then you would go to headache, down to cluster, G44009. Maybe it's a cluster that is intractable, so that would be a G44001. Or a cluster that's not intractable, G44009. Maybe it's a headache that is from a spinal puncture, post-spinal puncture, which is a G97.1, and those are terrible headaches, I hear. Maybe it's a tension headache, so headache down to tension or tension type. And the same thing, is it chronic? Is it episodic? Is it intractable? Is it, just kind of plug it in. But that's how you use it. But I had said, let's do headache. So I just said plain headache. So it's headache R51. So let's go verify. R51. We'll see what's on that page. R51. Okay, it's on page 1173, 1173. Second column, R51, headache. Also, you could code this for face pain. Very common. If a person comes in and says they have face pain, this would be the same code that they would use. Face pain not otherwise specified. The excludes tells us if the patient's complaining of atypical face pain, then it's G50.1. So don't use this one. Go to this G50.1. If atypical face face pain fits your scenario. Same thing, say they have trigeminal neuralgia. You've gotten a headache based on whatever in your documentation got you here. And trust me, the docs write a lot of stuff, so this would not be unheard of to be here. But you were actually looking for trigeminal neuralgia. Well, there it is. So go to G50.0. Okay? So this is the basics of how to use the manual. Probably this is the only video I'll do for this week, just kind of get us going this way. And then the next video that I'll do will be on guidelines, all these red guidelines, and then a little bit more in depth on how to find things in the, well, I don't know. Let's do a little bit more. How long is this? I know you guys, oh, it's already an hour. Now, the next video, I'll do more of in the index. There's some action words that will kind of help you find things better. Infection is one of them. Sometimes you go there. The pregnancy codes and the complication of pregnancy, those are kind of tricky. So if we don't cover those on the call Wednesday, then I'll do a video on those. So we'll just make this good. Okay, so this should give you the basics, kind of help you figure out how to use the manual. This is just beginning, and you should be good to go. Lots of good exercises in the textbook, 3, 2, 1 code it, so you should be good to go.